If we deconstruct the diet and say, well, why would the diet have helped in the first place? We actually could get people to a better outcome more quickly and deal with some of those underlying root causes instead of just masking it by keeping them free from various foods and food groups.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I've been thinking about how food has been impacting my health. What do you think?
Oh my gosh. I mean, we talk about this all the time. You know, my favorite thing to talk about is food, and it's my favorite form of exercise is eating, kind of working my jaw muscles and really getting into it.
Yeah, you've got buff jaw muscles, but you've got the metabolism to hold up, my friend.
Yeah, exactly. And, all kidding aside, I think we all appreciate in the practice of dermatology that patients always come to us because they see something on the outside, right? And they say, maybe it's something I'm doing on the inside. And what is the first thing that anybody does on the inside? It's food. And so nutrition and skin are so well connected. And one of the things that we lack, as we always complain about in medical training, is good nutrition training. So I'm going to make a suggestion. Let's get an expert here who knows a thing or two about nutrition, and maybe we can think through some of these issues together. What do you think?
I love that idea. I'm going to eat that up. Okay, so let's, all our dad jokes and puns aside, we're super excited to welcome Jennifer Fugo, who is a clinical nutritionist, and she's been working in the skin space, dermatology space. I've shared some patients with her, in fact. And, she addresses a range of topics, including adults struggling with chronic skin issues and gut challenges. So she's worked in eczema, psoriasis, rosacea, and she has a master's degree in human nutrition, and she's a licensed dietitian, nutritionist, and certified nutrition specialist. I think you're the perfect person to be talking about food with, Jennifer. Welcome to the podcast.
Thank you for having me. I'm excited.
Very excited to have you here, Jennifer. And perhaps you can start by telling us how you got interested in skin, because I think it's an interesting story. Many people have right nutrition training, but most of them don't go into skin. So I'm kind of curious, how did you end up with skin interest?
I had dyshidrotic eczema on my hands. I've also suffered with hidradenitis suppurativa under my armpits, and I have a few other issues. I had acne as a teenager, but it wasn't the motivating force, we'll say. The eczema and the HS were by far the more problematic issues as I was an adult, and I found that when I was going through the process of trying to figure out what was going on, because the eczema actually flared up in 2014 when I was in grad school. I had HS that started, it was like 3 weeks before I was getting married. Talk about a stressful time.
Wow.
And that was in 2010. So as an adult, I had these interesting onsets of chronic skin issues. And I will say that what really interested me was that the main recommendation when people want to take action on their own is just to cut food out of their diet. And it must be a food sensitivity. That's what everyone says. It must be a food sensitivity.
Right. Oh my gosh.
And
Yeah. Oh yeah.
I felt like it had to be so much more than that, especially given all of my training. And also, I love to think outside of the box. And I just found that going through what I was experiencing, removing foods didn't actually do anything for me. So if it was the case that it was this food sensitivity, why didn't it work for me? So I think that's where we need to revisit the concept of what type of diet recommendations we make to people, how we discuss diet with clients or patients, and also considering, is it possible that if a diet does work, could it possibly point to a problem that we might not, be thinking about to start with? So I just thought this was a really interesting topic to share today, and I hope your audience will be interested.
Absolutely. And I really like the way you're thinking about this because I agree with you. I mean, people come to me not just with skin conditions like eczema or pretty much any skin conditions, like I said in the introduction, they immediately point to the diet. And it actually makes a lot of sense. And I think that more often than not, I think in Western medicine, we tend to kind of poo poo that idea. But I think more and more people are coming to realize that the gut plays a significant role in everything that happens in our body. I mean, geez, I mean, it's almost silly to think it's not. And what we are lacking is the understanding on how to manipulate this to our benefit. And so, one of the things I know that one of the conditions you mentioned, and I know that you're very interested, is in eczema. And perhaps you can kind of take us through your thinking process when a client comes in with complaining of eczema and maybe a dermatologist sent this person your way. How do you approach this in terms of recommending a diet or kind of common plans? I know that a lot of this had to do with some tailoring to the personal needs, but what are common principles that you apply there in eczema?
So with eczema, one thing that I'm really trying to rule out is there a potential for what I describe as an excessive histamine state or histamine overload? Because in that particular instance, you have to utilize a pretty restrictive elimination diet, unfortunately. It's one of the few that, while I'm not pro elimination diet, and especially not long term use, this is one where I have to identify whether this is necessary or not. And then also, too, is it possible that there is an allergy that someone isn't aware of? And so, if that's the case, then my first thing is you've got to go back and see either your dermatologist or your allergist and ask for testing, because we want to identify allergies and make sure to get those out of the system. There's a lot of diets that people will come in on, and that usually by the time they get to me, they've already tried, and literally there is an eczema diet. It's been coined and there are books written about it. There's the low FODMAP diet, low salicylate diet. There's also people who go more like vegan or plant-based. There's those that are going more carnivore. There's then the keto diet. There's low histamine, as I mentioned. And then we have this litany of other foods that people may avoid that could include gluten, dairy, sugar, eggs, and all sorts of random things that they might have identified either because they read about it in a Facebook group or some nutritionist or health coach told them that this is inflammatory, or they did a food sensitivity on their panel on their own, and the test told them they have this litany of sensitivities that they've now had to eliminate, and oftentimes are afraid to include in their diet because they just have no idea whether it's a trigger or not. So for me, it's identifying, is there a histamine issue? Is there a potential allergen? And then also, I would say, making sure then that we aren't so skewed in one direction that we've removed nutrients and nutrient deficiencies are incredibly common in those who have eczema.
Right.
And so if someone has done a certain style of a diet for a very extended period of time, my concern then is saying, okay, let's take a look at blood work. Let's identify any potential labs that should be run, because we always have to remember the body does not make most of the nutrients it needs to survive. I think we assume too much that the body is just going to keep trucking on, and it will to some degree. But as wells increasingly dry out, we see this with vitamin D or even vitamin A. Vitamin A is an often overlooked nutrient that few doctors actually seem to want to test for, unfortunately. If you are low in vitamin D, there's a very high likelihood that you're also low in vitamin A. So we want to make sure that we're looking at this holistically. And then also, is it possible that there could be an underlying gut issue that could mean that when someone did a particular elimination diet, it actually helped? And so I like to think of elimination diets as tests. Yes, they can calm down inflammation. However, I think they're overused, and we allow people to think that they just have to stay on the diet forever. And maybe if we deconstruct the diet and say, well, why would the diet have helped in the first place? We actually could get people to a better outcome more quickly and deal with some of those underlying root causes instead of just masking it by keeping them free from various foods and food groups.
Jennifer, you are touching on a couple things which I think are so cool that we're talking about this. So, first and foremost, these diets that people have, just because you're on a vegetarian diet or just because you're on a low FODMAP diet, still doesn't give you the details on what foods they're eating. So, I love the fact that you're focusing in on food. So, maybe you can talk a little bit more about how do you select the foods. But prior to that, can you talk a little bit about food sensitivity testing? Because you brought up an awesome point, which is people go and get these food sensitivity tests, and then they get results that are all over the place. And the problem is a lot of these tests use IgE, some use IgA. I still haven't seen really good evidence that, especially IgE is like not even the way most of these allergies work, because that's the allergic response that's more driven by histamine, but that's not always the driver in, say, eczema and whatnot. But how do you approach food sensitivity testing? I personally hope there's more studies, but maybe you're aware of some studies, or maybe you have an approach that could be like a way to look at these. How do you include this into your clinical practice?
So I am not a fan of food sensitivity testing. I'm just going to flat out say that. The reason,
Thank
the
you.
reason, and
Yeah.
it's also for anyone out there listening to this, if you are wondering, is it worthwhile? And you have patients asking you, should I do these different, they're marketed to them on Facebook and Instagram and even on TV and Google ads and all sorts of things. These types of testing that people can buy on their own, they're a waste of money. I don't know how else to say it other than that. It's not to say that they couldn't potentially have a reaction going on to these foods. However, if there is gut permeability present in the GI tract, you're going to be sensitive to essentially whatever you eat on a daily basis. Most people consume the same foods for the most part every day or every few days. They eat the same things. Most people are not eating completely different every single day, every single meal. And so if you're exposed to, I don't know, buckwheat cereal and you have a ham sandwich with Swiss cheese for lunch on whole wheat bread, and then for dinner you have, oh, I don't know, salmon with broccoli and cauliflower and some green beans, you could end up getting a food sensitivity panel that tells you that all of these are high sensitivity foods and you need to avoid them. And it's simply because there is a permeability issue happening in the GI tract. And what has happened, and this is unfortunate, and I will say it is probably the result of miscommunication and also oversimplification in, I think, more of like the functional medicine world, and especially in like paleo and a lot of these other diets that emerged, I would say the last 8 to 10 years, was the focus was always on it's the foods that are making you sick, it's the foods that are causing leaky gut, and so your problem is leaky gut. And so everyone is oriented toward fearing leaky gut, not realizing that the problem, yes, gut permeability is present. However, it's why is it present? And that's where the education is very lacking. And so all they see is leaky gut, food is the problem. I need to eliminate it. I'll heal my gut. And that's not actually how it works. And so when we have clients that come in who have testing like this, we say, look, I'm really sorry, this testing isn't helpful. We want to look at what could have caused the gut permeability in the first place. And that's where we start to dig into what the microbiome looks like, what their digestion looks like, digestive transit time. Are there exposures to NSAIDs, or were there for a significant period of time, or other stressors that could cause gut permeability, and other nutrient depletions that could also play a role. So we're looking at this from a much different perspective that's not as simplified as just you have leaky gut and avoid these food sensitivities.
Jennifer, that's so interesting because, and this is a common theme in medicine that I find a lot of times tricky to explain to patients, is about testing in general. And I try to tell them, look, we can test a lot of tests. The question is, what are we going to do about it? And let's say we find something. What does that mean? And I think you touched on all this, particularly when it comes to food sensitivity testing, but I think it's true across medicine. It's a barrier that I think as physicians and clinicians in general, it's on us. We really need to educate the public and to understand how testing is used and what it's good for and what it's not. And maybe maybe you'll agree with me or not, but one of the silver linings from the pandemic is that everybody now can understand testing. All of a sudden, everybody's like, oh, I get it. This is the PCR test. Or they get, oh, this is an antibody. This is an antigen. Everybody's immunologically coherent all of a sudden. So it does make the conversation a little easier. But thank you so much for highlighting that need to understand what is the test? What is it telling me? And what can I do about it? And if it's not, then maybe it's not so useful and maybe we shouldn't spend our money or our resources there. I think the other thing you said that I really like, and specifically about eczema, is the elimination diet because as everybody knows, most of the people who are affected by eczema are actually kiddos, and trying to eliminate essential nutrient from kids can be really, really stressful on the body in general, and maybe actually go in the wrong direction as to what the parent actually was trying to do. So, I always say, if you want to try some elimination diet, do it with a nutritionist. You have to do one thing at a time. Do it with a professional. Do it the right way. And it's not enough to say, oh, I eliminated it and I got better. Then you want to challenge it and see that you're actually getting worse, because who knows what kind of confounder is getting in the way. So thank you for all these comments. I wanted to move forward and talk about how do you help people implement these kind of strategies. Let's say you found something. How do you go about implementing a diet? Do you have any specific tips that you give patients? Because I know that one of the things you mentioned is that maybe we don't need to go so far as doing it for the rest of your life. But any other tips on how to implement this to help to reduce the triggers, and especially in eczema cases?
Yeah. So, one thing that I think is super important is to ask the patient or client, what foods do they know for sure that they seem to be reacting to? Because most people do know. There can be things that might be a little harder to sort of suss out, but generally speaking, most people can point to very specific foods. So I had a client recently who said that she noticed she had a lot of trouble with more like the cruciferous vegetables. Well, the cruciferous vegetables are FODMAPs. And when you ask, well, what type of problem are you having? Because that's also equally important. She would get gas and bloating and maybe some loose stools. And so, like FODMAP, for example, if someone's struggling eating higher FODMAP foods, that could be a sign of small intestine bacterial overgrowth or also overgrowth within the large intestine. If someone tells you that they can't seem to tolerate salicylate rich foods, which are a litany of really, really healthy plant foods, that actually doesn't mean, unless they have a legitimate allergy to it, it usually means that they actually have a really high need for the amino acid glycine and vitamin B6, because their phase 2 liver detox, where salicylates are processed, is overloaded and does not have enough of these substrates in order to process salicylates. With a plant-based diet, if someone seemed to have done better on plant-based, what I would suspect then is low stomach acid. And I would want to potentially look for an H. pylori infection, because we want to identify what are the reasons driving that stomach acid low. And oftentimes people will say, well, I find that I just don't digest meat, or I feel sick after eating meat, any type of animal protein. And that can be one little underlying key. With carnivore, if they find that they actually do better and flare less on carnivore, where they only consume animal products, so meat, milk, eggs, etc., that can actually mean that there's a GI overgrowth that is problematic towards different things in plants, like could be FODMAPs, but there's usually some sort of overgrowth in a different type of direction than those who seem to have issues with just being plant-based. Whereas with histamine, if there's too much histamine in the system, again, identifying the digestive process is really important as to where there are issues. But I would caution anyone to recommend supplements, more so digestive aids, that contain betaine HCl. What I have found clinically is that in those who have histamine, well, I just call it histamine overload, but where they may be on a ton of antihistamines, maybe they're on 1, 2, 3 different antihistamine medications. They might also be doing a lot of quercetin and bioflavonoids, maybe nettles, a lot of different herbs, and maybe supplements that are antihistamine. Oftentimes that is a clue that there's just too much histamine in the system, and betaine HCl, unfortunately, will usually make things worse, and they'll feel worse as a result of that. So it's unfortunate that there may actually be a depletion of stomach acid, but by trying to increase it, it makes everything worse. So we definitely want to look for, are there any allergies or cross-reactive allergies that the person is consuming? For example, ragweed allergies cross-react with stevia. and other liver detox supplements that contain herbs like dandelion root and milk thistle. And then also, we want to be careful in saying, okay, could there be a constipative issue? We want to make sure to keep the bowels moving and make sure to support the GI tract as best we can. So, digestive enzymes, again, without that betaine HCl, identifying those trigger foods and trying to just get the GI tract calmed down so that the person can tolerate foods without necessarily having a flare, with the plan down the road, hopefully in the next couple of months, to start reintroducing things, supporting regular bowel movements. That means having a bowel movement 1 to 3 times a day that is healthy and well formed. Daily movement is so crucial to also support that. I always ask clients 10 to 20 minutes daily. And then I would highly suggest check for allergies. Do allergy testing in your offices for food, pollen, and other environmental allergies. Look at labs for nutrient levels. Looking at a CBC panel isn't enough. Looking at a comprehensive metabolic panel is not enough. You do actually have to look at nutrient values like vitamin D, vitamin A, vitamin B12, folate. Those are some really good ones to start with. And a lot of times with minerals, the red blood cell or erythrocyte values are actually more valuable from a nutritional standpoint because we can see what the cells have access to as opposed to the plasma versions. And then, two, if you're finding that somebody's really struggling, they've eliminated a lot of foods, and you're just not comfortable with making recommendations and following them because you just don't have that time or the bandwidth, I would highly encourage you to refer that person to a nutritionist or a dietitian, because disordered eating is a huge problem within chronic skin issues.
Yes, thank you so much for highlighting that. And absolutely, as you were talking, I'm going in my head like, oh my God, this is all great stuff. I can't keep up. I can't write it. Hold on, stop. And as I'm doing this, I'm realizing really what you need is a professional. I think patients come to us and they expect us to know everything and can't be an expert in everything. And so you want to find the right network of people. And gosh, if you have Jennifer in your neck of the wood, well, boy, you're lucky. Maybe she's doing telemedicine. I don't know. But in
I
general,
do.
you do. Okay, great.
I
Excellent.
do.
Fantastic. So she's very, very easy to find online. But I wanted to go back to this and highlight how frustrating it can be for people, because you mentioned some of the healthy, quote unquote, foods that they're trying to eat
Mhm.
or good habits. And those are the ones who are actually triggering whatever their skin is experiencing and in general, their health. And that speaks again to the idea that some of the stuff we don't have fully figured out, and some of the stuff is really complex. I mean, this is a system that evolved over, thousands and thousands of years, and our digestive system is so complex, and then its interaction with the immune system. And we didn't even talk about hormones. I mean, this whole thing is just one complex network of reactions. And to assume that, with one day you can figure this out so quickly or with one test, I think is a little presumptuous from us. So thank you for, through your words, really highlighting the complexity of this. And I'm sure that now a lot of clinicians will say, my gosh, I need a nutritionist like Jennifer in my back pocket. So if we did that, that's a great service. I do want to ask you one last question, Jennifer, because, and this goes more to our patients and our clients, because one of the interventions you will inevitably suggest is a type of diet, some type of
Mhm.
restriction usually, or supplementation. And probably what I find for myself and for anybody who's struggling with diet issues is the ability to keep up. And maybe you can give one tip that you tell patients who come to you and say, I've tried it. I know I need to do this. I know I need to do that, but it's so hard with food. One tip that you can give people out there struggling with this kind of idea of discipline with food.
I would say you have to figure out with them what makes it manageable and doable. And if they have an eating disorder or a history of it, it may not be possible to have them on an elimination diet or a very strict diet. So you have to determine what that person's tolerance is. So for some clients, I may just say, look, could we just try with dairy? Like, let's just start with dairy. And here's a list of things that could replace the common things that I know you're already using in your home. Instead of handing them this huge plan that they will not follow. And I think that's where we tend to feel like it's an all or nothing thing, that you're a bad person. If you can't follow it, you end up feeling like a failure. And so we want to encourage people to do what they can. If that means that it takes them week 1 to do this, week 2 to do that, and it's a slow onboarding process, then so be it. Everyone's journey is different, and we have to allow space for that without judgment so that people also don't feel like they failed. Because with skin issues, and I'm sure you both know from having worked with thousands of patients, you oftentimes feel like you can't do anything right. And when you can't stick to a diet, it's just one more sign to, it was to me and to many of my clients, that I'm just a failure.
Oh my God. Yeah, that's so true. So
Yeah,
true.
so just meeting someone where they are and allowing space for the fact that that person's journey might not look like someone else's, and it's okay. And getting the type of help and support they may need, and if they really can't stick to a particular diet, then the question would be, what else could we do that could possibly move the needle? Is it possible that they do, say, like a meal planning service, or have someone cook meals for them and freeze them? Like, let's try and troubleshoot this for them to make it as easy as possible.
Yeah, I love that troubleshooting. And there's so many different practical things we can offer. I find that in my practice, a lot of time, they just need to speak it out and kind of say, I'm having trouble with selecting this or that. And then we kind of talk about, okay, well, you can solve it with this practical solution. And they go, oh my God, I never thought about that. And that changes their whole demeanor and approach to the management. Wow, Jennifer, we started with the skin, went through the gut, and end up with mind body kind of concepts. Thank you so much. Obviously, you bring a lot to the table, and it's so much fun to talk to you. Every time I talk to you, I feel inspired. So thank you for your time, your expertise, and looking forward to seeing you somewhere on the airways soon.
I do want to make a comment here too, Jennifer, because you have a podcast called the Skinterrupt Podcast. I know Hadar, myself, many of our colleagues have been on there as well. So I want to applaud you for doing your part to get the information out there.
And building a community, yeah.
Yeah,
Kudos.
and thank you. I appreciate that we're able to connect both practitioners and physicians and patients. And, for anyone who wants to dive deeper into this, I do have episodes on the Healthy Skin Show about this and about the role that diet can play, and especially when diet doesn't work and actually makes things worse.
Thank you so much.
Hey, Raja, do you know where the integrative medicine movement started?
According to Google, since Google knows everything, Dr. Andrew Weil founded the Center for Integrative Medicine at the University of Arizona in Tucson back in 1994. Why do you ask?
Well, you know how we always try to get to the root cause? I think we need to go big for the fifth annual Integrative Dermatology Symposium. How about we do this? Let's meet at the Los Ventana Canyon Resort in Tucson, Arizona. Or you can join virtually from September 30th to October 2nd and hear from the world-renowned experts like Andrew Weil.
Exciting. And our theme is connecting mind, body, and spirit to take a more holistic approach to our patient care. What do you say?
Absolutely. I mean, where else can you get the latest on diet and dermatology, hypnosis, botanicals, common diseases, aesthetics, and other unique topics in dermatology with practical takeaways to start using in clinic right away?
So true. And let's not forget, we've got the new track for estheticians too. I think I'm going to need to call in a sick day or two before the symposium so I can enjoy the waterfall and trails on the resort, stargaze, play a round or two of golf or tennis, relax at the spa, and catch up with colleagues at the evening receptions.
Yes, that place is spectacular. Use our discount code POD25 at checkout for 25% off.